All right, if you've got young ones in the room right now, it might be a good time to just kind of scoot them out for just a second. Today we're talking about sexual health when you're being treated for depression. Dr. Irwin Goldstein from San Diego Sexual Medicine Alvarado Hospital is here with a first look at a new medication that treats depression apparently without causing sexual side effects. And this is huge because most people report having some sexual side effects if they take an antidepressant, right?
Right. So, Erica, thank you for doing all these things. So depression is very timely now. I mean, it gets dark so early, and the Christmas season's up, all the stress, and so depression is common. 30 million Americans actually take drugs for depression. 2.5 times more in women than in men, Caucasians more than minorities, and over 40 more than younger. So depression is common, and the problem with treating depression is the drug that's usually used, called an SSRI, selective serotonin reuptake inhibitor, causes sexual side effects in almost half of the users. Less interest, less orgasmic intensity, pain, less arousal. So a lot of people stop the medications even though they're good for them because they don't like having the sexual side effects. So we've been looking for a drug that treats effectively the depression but doesn't cause the sort of problems sexually that people don't want to have. So up front comes this new drug. It's called Vilazodone. That's its chemical name. The real name is Viibryd. V-I-I-B-R-Y-D. And in a study of 860 people in a double-blind, placebo-controlled trial, published in yours truly, the Journal of Sexual Medicine, that only 8% of people versus the 50% of people get sexual side effects. This is a huge drug.
Are there other side effects instead of the sexual ones?
Right.
People are finding, you know, there's another side effect?
There are classic sort of SSRI-related non-sexual side effects. For Viibryd, there's some stomach stuff, diarrhea, nausea. It's actually relatively mild, and you could take low doses and sort of work your way up to the real dose so that you can minimize the sexual side effects. So I had a patient who desperately wanted to come here, but I don't know, she couldn't have the energy. So I'm going to speak for her.
Okay.
So she was on a whole bunch of SSRI agents and had a whole bunch of sexual side effects and came to the San Diego Sexual Medicine facility. And we put her on Viibryd. So as she tapered off her drug, we tapered into her Viibryd. And she had no depression, and she had great mood, and no sexual side effects.
Wow.
And she was on it for 6 months, and she sort of said, okay, I'm now going to get off the medication and see if I still need the depression medication. She sort of still needed the depression medication, went back on the Viibryd. She's now 1 month on it. Her depression's not there anymore, and her sexual function is fabulous. So on behalf of her, we sort of are bringing this up.
Sure.
There are some tips one can do, because this is sort of a depressing time between sort of November and March where it's dark early.
And the holidays are difficult for some people.
It's sort of depressing. It's the opposite of this potted pottery thing that you did. The energy that they had was fabulous. But so there are antidotes you can take. Actually, Viagra is a fabulous antidote for people with sexual side effects on SSRIs, and it's published in the Journal of American Medical Association, the use of Viagra. There's a drug, bupropion, which is Wellbutrin. It's a good antidote for SSRI sexual side effects. There's another drug, buspirone, which is another antidote. So you can sort of mix drugs to sort of get rid of the sexual side effects. But finally, we have a new drug, Viibryd, that allows people to get good depression control but not have the sexual side effects.
If somebody's watching this at home today and they are on an antidepressant and they're not super happy with it, what advice would you offer them?
Well, you can look on the internet, Viibryd. You can say, bring a sheet into your doctor and say, would you consider trying me on this? It's a very effective antidepressant drug, so it should be that that doctor would be willing.
Are there some people that are especially good candidates for this, and then others that maybe they're not going to be a good candidate for this?
Probably, yes. It's a newer drug, so we don't have all the data about it, but gosh, if sexual issues are knocking you down while you're taking these medicines that make you alive and not depressed and sad and without ego and without a life quality, ask your doctor to start you on this medication. Essentially, all the patients who come to our office on SSRIs, and there are an awful lot of them, it's essentially 1 in 10 Americans are on these drugs. We encourage them to sort of taper down on there and taper up on the Viibryd right now, and it's been very successful.
How long has this drug been out?
January 2011, it was FDA approved, took a little while to get to the drugstores, and then we didn't have the data yet on it. It said it had less sexual side effects, but we really did need to prove it. A lot of people say that stuff, but we really need to have good data for it.
And the data's come out and it backs that.
Yeah, God bless it. 8%, that's incredible. That's really
huge.
good, yes.
Dr. Irwin Goldstein, thank you so much for being
thank
here,
you.
as always. If people would like to get in touch with you, you are at San Diego Sexual Medicine at Alvarado Hospital. All you have to do is go to our website, fox5sandiego.com. Click on that Scene On tab. All right, Raul, let's send it back over to you.
Erica, thank you. Always good to have the good doctor here with us.